Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about hepatic adenoma. So what do you see in hepatic adenoma? Hepatic adenoma is actually a benign proliferative disorder. What is hepatic adenoma? It is a benign proliferative disorder of hepatocytes is called as hepatic adenoma. Okay, now this hepatic adenoma has low risk of malignant transformation. It has low risk of malignant transformation to hepatocellular carcinoma. It is most commonly seen in females and it is associated with OCP use. And here in hepatic adenoma, the hepatic architecture is not maintained. Okay. Then, if there is poorly supported peripheral blood vessel, in poorly supported peripheral blood vessel is present in the hepatic adenoma. So because of this presence of poorly supported peripheral blood vessel, there is increased risk of hemorrhage is seen in the hepatic adenoma. There is increased risk of hemorrhage and necrosis is seen in hepatic adenoma, and thus this will cause symptoms which will lead to abdominal pain. It will result in symptoms of abdominal pain, and it will also causes high risk of increased risk of tumor rupture is also seen. It also causes increased risk of tumor rupture in 30 to 50% of the cases. Okay, then one more important thing, if you see the risk of tumor rupture, if you see, this will increase in pregnancy. The risk of tumor rupture increases in pregnancy. Then what about the clinical features of hepatic adenoma? If you see the clinical features, most patients of hepatic adenoma are symptomatic patients. And what is the most common symptom of hepatic adenoma? Most common symptom of hepatic adenoma is abdominal pain is the most common symptom of hepatic adenoma. Then here in hepatic adenoma, if you see, tumor rupture leads to hemoperitoneum. In hepatic adenoma, tumor rupture leads to hemoperitoneum. This hemoperitoneum will result in shock in the patients. Then, if you see the diagnosis, what is the investigation of choice of hepatic adenoma? CECT is the investigation of the hepatic adenoma which shows peripheral hypervascularization. Okay, CECT is the investigation of choice of hepatic adenoma which shows peripheral vascularization. And on treatment, you will see presence of excision of hepatic adenoma is the treatment. Thank you for watching.
Thank you and thank you for watching.